Hello everyone and welcome to Soma Vitality Wellness. So in today's video I'm going to discuss about what is progesterone and what are the signs and symptoms you get when you have low progesterone. So let's start with what is progesterone. Now progesterone is an important sex hormone released from the ovaries. It governs your second half of your menstrual cycle and has important functions like maintaining the uterine lining for healthy pregnancy, and it also has anti-anxiety effects. Now, this hormone can be broken down as pro meaning before and gesterone meaning gestation or pregnancy. Now, in the body, progesterone has two different parts each month, depending on your fertilization and ovulation. So, if your ovulated egg is fertilized, then progesterone rises after ovulation to help thickens the uterine lining for pregnancy. But if your egg does not become fertilized after ovulation, then progesterone peaks and then it declines, because you do not now need it for pregnancy. This uterine lining will shed and that what becomes a period. Now generally problem arises when this progesterone levels are too low when you are trying to conceive. Another important factor to remember is that we have to ovulate to produce progesterone. Now, if progesterone is delayed or affected, this can affect your progesterone production. So let's understand what are the signs and symptoms you get when you have low progesterone. First, very important sign is your PMS. Now, premenstrual symptoms happens where in the luteal phase of the cycle before your periods. Symptoms could include your cramps, bloating, headaches, nausea, fatigue, mood swings, breast tenderness. All these are symptoms that you get. Now, after the menstrual cycle begins, symptoms typically disappear. Now, the reason PMS is one of the signs of low progesterone because of the difference in hormonal levels between your estrogen and progesterone. So if to understand, during the start of the luteal phase, progesterone is increasing. But if pregnancy doesn't happen, it'll drop by the end of the phase. Now this drop in progesterone may be more extreme for some women, and this causes the estrogen to increase rapidly. And this extreme shift in the hormone levels is the cause for PMS symptoms. Another thing we can sign and symptom of low progesterone is your irregular periods. And there could be other reasons, but the main cause of irregular periods is lack of normal ovulation. Now, lack of ovulation where the egg is not released from the ovary causes low progesterone because the body is not preparing for pregnancy. Another symptom is your painful periods. Now, painful periods or dysmenorrhea is when you get painful cramps before or during menstruation. So understanding why you get that, one of the reasons for cramp is your high level of prostaglandins. Now, prostaglandins are sex hormones that work in opposition with progesterone. So when your progesterone decreases right before menstruation, the prostaglandin will increase. And this prostaglandin in the reproductive system helps in the contraction for labor. But when you are not in labor, these contractions are what is labeled as cramps. And this is why painful periods is the sign of low progesterone. Another sign and symptom we see a lot because of low progesterone is your cyclic headaches. Now, these are the headaches that occur at the same time each menstrual cycle. It's one of the signs of your PMS and is also a sign of low progesterone. So again, understanding when your progesterone is low, this puts you in an estrogen dominant state. Now, what happens is this estrogen can cross the blood-brain barrier very easily. So this causes the brain level of estrogen to rise and low levels of progesterone. So this high level of estrogen and low level of progesterone is what causes the cyclic headaches. Another thing to remember is bloating. Now, study has found that in the luteal phase, when just before your periods, there is a water retention as well as sodium retention increases because of low levels of progesterone and high levels of estrogen. Another symptom you see a lot is heavy periods. Now, studies have done, and that shows that when progesterone is administered, it has an protective effect on reducing the flow of heavy periods. Now, heavy periods result from imbalance in your estrogen and progesterone. Now, understanding another sign and symptom of low progesterone, which we get a lot in our clinic, is infertility. Now, this is because adequate progesterone is necessary for healthy fertility. As we have discussed before, progesterone helps to maintain the integrity of the uterine lining for the egg to implant. What happens when you have lower progesterone levels? That puts you in a higher risk of miscarriage and can be one of the reasons behind your fertility struggles. Another sign is your first trimester miscarriage. Now, the first trimester miscarriage is where most miscarriages occur typically. Now, the first trimester is the most vital stage because the fetus is very fragile and it doesn't have all the organs and limbs formed yet. It's very important to have the optimal level of progesterone for healthy pregnancy. Now, the studies have shown that when the progesterone levels are low, and when it is administered the progesterone in the first trimester, they have a better chance of reducing miscarriages. So again, a lot of time we see what is the reason for our miscarriage, and it's as simple that you could be having a low progesterone. And now with another thing that we see a lot during before and our periods is poor sleep as well. Again, a very important thing to remember is again a sign of low progesterone. Now, they did a study and they found that those who were given progesterone has a better ability to restore normal sleep when disturbed at night during the compared to the control group. Another sign we see a lot of low progesterone and anxiety. Now, anxiety is an experience of feelings of worry, helplessness, and fear, and that can have an overpower aspect of your day. Now, progesterone has an anti-anxiety effects because of its relationship with GABA, which is a natural relaxation mood chemical. Now, if your progesterone is low, you are not producing enough each cycle. This can show up as anxiety because you are not producing enough GABA. Another thing that we see a lot during PMS and initial stage, in our luteal phase is irritability. Another sign of low progesterone. Now, progesterone has an effect. It helps in reducing the irritability and mood swings because it has an effect on cognition. Now, studies have found that when progesterone is administered, there was significant improvement in the mood and irritability. So let's just summarize everything and understand what are the signs and symptoms you get when you have low progesterone. It is PMS, irregular cycles, period pain, now cyclic headaches, you get bloating, now infertility and first trimester miscarriages is again, or recurrent miscarriages are all signs, could be the signs of low progesterone. Then there's heavy periods and anxiety, irritability are all of the signs of low progesterone that the body is showing, sign the body is giving you that there is some problem, and it could be because of low progesterone. Now, if you're looking to understand the root cause of your low progesterone, then you don't forget to book a 30 minutes free consultation with us. And in my next video, I will be discussing how to increase your progesterone naturally. Now, if you like this video, give it a like and subscribe to our YouTube channel where you'll be given all these healthy tips every week.